Hello and welcome back, everyone, to another episode of How to Speak Cancer, the podcast. In the last episode, we talked about what we can do to detect and prevent cancers, and I mentioned a few times that we are going to talk about the most common cancers a bit more in depth here today. Um, Today's podcast, I want to talk briefly about different types and symptoms of different cancers. But I want to make sure you understand that this is not the whole picture. This is still just a brief overview. But I don't want to overwhelm my listeners, as this is intended to be for patients who dig into the world of cancer, unfortunately, or medical communicators, or nurses, or whoever it just is starting to explore the journey and explore the garden of cancer, how I like to put it. So I used some illustrations along the way, again, as always in the podcast, to give you a more, maybe like an imagery of what I'm saying. So let's start talking about breast cancer. I mentioned that before in the last podcast episode. It's one of the most common cancers, especially in women. There are also men who are affected. I think it is about 1% of breast cancers, breast cancer numbers that is affected by men, or men are affected by that. All right. So within the breast cancer, we have many different types. I wrote down the three main types which we see in the in the clinical practice most often. So there is the ductal carcinoma, which is a carcinome or a cancer that starts in the milk ducts. That is the most common one that most women are experience. So we then also have the lobular carcinoma. They start in the milk producing glands. And we have the triple negative breast cancer. It's a quite an aggressive form without common receptors. We have another podcast from MedTalks with Kathrin, where I talk with a breast cancer survivor, where we touch this a bit more in depth. So I will link this podcast here in the show notes as well. It's Andrea Behrend. She is also the reviewer of the German version of How to Speak Cancer. So she is very much into the topic as well. As I said, also a breast cancer survivor. Where so that we talk a bit more about the types. Common symptoms of breast cancer. Well, the main symptom that we always hear, and why we do the self exams, is the lump in the breast or under the arm, like in your axial pits. Not axial pits, in your armpits. Sorry, this was a German English mix. So in your armpits, you can you can feel lumps. I said that in the previous podcast that you have to not only examine your breast, but also the armpits and the up here to the collarbone lymph nodes. So don't just focus on the breast. So this is the main common symptom, is the lump that you feel, which can also be something else. So if you feel a lump, don't freak out directly. It can be a cyst. It's very often that we have cysts in our breasts. What we also experience, especially once the cancer is a bit more advanced, that the breast shape changes or the sizes change, that the skin changes, especially with certain kinds of cancer. The skin can become red, or just looks like an inflammation. And also a common symptom is a change in the nipples, or if something comes out of your nipple, we call that discharging. If you have a fluid coming out and you're not breastfeeding, of course, then you should also be aware that this might be a sign which might lead you to a doctor. And you'd rather go once too often than too less. All right. So this is a brief overview of the main breast cancer types: the ductal carcinoma, which is most common, the lobular carcinoma, and the triple negative breast cancer, which is least common but aggressive, and we should know about it. Aggressive means it grows fast and yeah, it needs treatment more urgently. Right, let's go to lung cancer. We have two main types in lung cancer. We have the non-small cell lung cancer, it's NSCLC. We see that in the medical communication quite a lot. And also in studies, there are a lot of studies about NCLC. So non-small cell lung cancer is the most common. And usually it's growing slower than the small cell lung cancer, which is the SCLC. It's faster growing, what means it's more aggressive. So it needs more care more urgently. Symptoms that you might experience is a cough that doesn't go away, an unusual shortness of breath, so it's harder to breathe. You can have pain anywhere where the cancer is situated. And when you start coughing blood, you should really go to the doctors. Mainly, also some maybe we talk about some common cancer symptoms that should make you go to the doctor is a loss of weight, even though you don't insist it, like you're not on a diet and you lose weight and you wonder why. Also, being very pale, which can be a loss of iron in your blood, because cancers need more blood, and then a lot of blood goes in there. So you might feel weak and tired, unusually tired. You sweat at night a lot. That is also something that we always ask our patients. So weight loss, unexpected weight loss, paleness, weakness, tiredness, exhaustion, and night sweat should all make you go see a doctor. That just in general, that goes for all the cancer types. Well, let's jump to the colorectal cancer. We have three different types, main types here. There's always more, but we just scrape on the surface. We have the adenocarcinoma, which is the most common type. We have carcinoid tumors. They start in the hormone producing cells and they grow slower usually. And then we have the squamous cell carcinoma, which is a rare type that starts in the flat cells linings, some parts of the rectum. So it's not that common, but one that is also one of the main types, basically. Common symptoms, we talked about that briefly in the last episode as well. We have changes in bowel habits, so we might have more diarrhea or more constipation. We might get out of control how we go to the toilet, or we can't go to the toilet at all. We might have blood in the stool, which we talked about, which is not always visible because it's mixed in the feces. So, yes, it's not really, it's hard to detect that blood sometimes, or often, yeah. Then unusual abdominal pain, wherever the tumor is situated and how big it is. You can even feel a lump. And fatigue, which I talked about in the previous slide, which is due to the fact that we lose our valuable blood to the tumor that is growing inside of us. Um, Again, it's very important to catch that early. Again, colorectal cancer gets more and more common in younger and younger people. So be aware of this. And especially colorectal cancer can be influenced by life choices a lot. Well, let's jump to the prostate cancer. There are two main types. We have the adenocarcinoma, which is the most common type. And then we have the small cell carcinoma, which is a rare aggressive type that grows quickly and can spread early. Common symptoms, you might know that, have heard of it, is difficult urinating, is when you have to go often, but then you can't get it out. Also, this is especially at night. So you might you might find it difficult to sleep through the night because you keep going to the toilet. And a very obvious symptom is also when you see blood in your urine. Then you should definitely go to the doctor. Well, let's jump to the skin cancer. We have the three main types here. We have basal cell carcinoma, which is slow growing. We have the squamous cell carcinoma, which is faster growing. And then we have the melanoma, which is more serious and more likely to spread and needs to be treated immediately. How can we detect that? When moles change, when they are bigger, or maybe they grow into a lump, or they they are not like really round. They can be more like stars, or they have a breakout somewhere, and that just change, especially if they change, or if something new grows, or if you have sores that don't heal. Like sometimes we have like tiny spots, and just we see that in elderly people often in their faces. It just doesn't heal, or it's crusted, and it just doesn't go away. This is something that you should definitely show your doctors. Then we have the blood cancers, which is a wide field. It deserves an own book. So I will just briefly mention here the main groups. We have leukemia, which affects the blood forming cells in the bone marrow. We have the lymphoma, which affects the lymphatic system. It's another system that goes through our body. And we that's the lymph nodes I mentioned earlier. We When we touch for the breast cancers, we have lymph nodes, and those lymph nodes are fed by fluid, and this is then the lymphoma and the lymphatic system. And then there are myeloma, which affect the plasma cells in the bone marrow. As I said, blood cancers are a very wide topic. There is a lot to say about it. We come in later episodes to this, where I talk more in depth about all the cancer types we talked here today. Key facts about blood cancers: we do not something that is something that we need to remind us is a blood cancer differs a lot from the solid tumors. And now we will talk about solid tumors as well in depth a little later on. But be aware that a blood cancer, it's not like a visible tumor you see somewhere, like a lump, or you can't feel it. They affect the system that floods your body. It's like a river, or like the water you use in your garden. If you have polluted water, your whole garden will suffer, and this is the same for blood cancers. So if your blood is sick, or your lymphatic system, which is also running through the whole body, it's like an underground water system that goes through your body. So you will be affected in like the whole body will be affected. It can't just be, won't just be one spot like the breast or the lung. You will feel it in your whole body. And the symptoms vary a lot. Also, the progress of the diseases vary a lot. Some are very aggressive and they need urgent treatment, and you feel very fast, very sick. Others, you can, they're called chronical, so you can have them for quite a while until you really note something. And then even doctors might not even want to do something directly, but watch it and observe it and see how it goes. So it's a very different field, and very specified. So let's just note for now, blood cancers is different than the other cancers we talked about, but it's a big group in the cancer world itself. In the cancer garden, we have a big part of the garden is blood cancers, because the whole garden lives from it. Why do I think you should know the differences? Mainly because it empowers you in your journey. I think knowledge is extremely important to not feel lost, and to feel a bit more reassured. I also think that the better you are informed, the better the questions get you can ask your healthcare provider. So it's more directed. It's and you're understanding what the doctor says, or the any HCP says to you. You understand it way easier once you understand the basics, which is why I start very low level here. Um, with all that understanding and empowerment, you can navigate your own route much better. So you are more of a care partner for your doctor than just a passive patient who does what the doctor tells him to do. And I think it's very important that we feel that we have power over ourselves, because it's our body. We want to usually we want to know what is happening, and we want to be a part of the decision making process. And even if you don't want to have that responsibility, it's always good to know what you're actually going through, what your body is actually going through. And yeah, I hope this podcast helps you slowly to detect more and more what we are talking about in the world of cancer. If you want to dig deeper into the topic, you are welcome to read in the book, or you are welcome to follow the blog post on my website, which is fed by the book. So the book is ready, done. You can get the whole book and you get the whole information, or you just follow my blog and the podcast here and get information bit by bit. Otherwise, I want to thank you for today's listening to me. And if you have any recommendations, any questions, anything you want to discuss, I'm very happy to talk to you. Contact at katrinkunze.com, or you scroll through my website www.katrinkunze.com and see if you find anything else that helps you moving through the journey. Otherwise, I will say goodbye for today, and I'll see you in the next podcast. Bye.